Doctors gave up fixing her sciatica, but today she feels brand new. After helping hundreds of people who suffer from painful sciatica and battling it myself when I was younger, can you tell there's probably no more aggravating form of back pain? Sometimes you can't sit. Sometimes you can't stand. Sometimes you can't walk or drive. Or even lie in bed. The pain is simply wretched. A couple days ago, someone came into our clinic on her hands and knees. It was the only way she could find relief. She was in tears. The pain radiating down her legs was unbearable. She actually inspired today's article. Today I'm going to tell you what I told her. Every week, in fact, my clinics and programs are a destination for people from all walks of life who suffer from sciatica. The first thing you should appreciate is sciatica is not a disease. That's right. Allow me to be clear about this, because it's important. Sciatica is not a diagnosis. If you're seeing a doctor and they're telling you that's what you have, you're not being told the whole truth. I have doctors who are in pain visit my clinics, so I know. Let's put it this way. Sciatica is a symptom. The doctor is only labeling a symptom. They're not telling you what is actually wrong. Now when they put a label your pain, I totally get how good that makes you feel in the moment. What happens next? They prescribe some heavy-duty ibuprofen to calm the inflammation, maybe ship you off to a physical therapist, and then they're on to the next patient. And you already know how that works, don't we? Let's face it. The reality is a lot of doctors fail to fix their sciatica patients. They return repeatedly with the same pain, the same issue, the same cry for help. The doctor eventually begins to wonder whether the patient even wants to get better. Imagine that. It doesn't quite occur to them it could be the treatment that's not working. And that's because that sciatica diagnosis just becomes an easy way of sending the patient home happy. For the record, sciatica is the term that describes symptoms of pain that begins in the lower back and extends down through your butt, thigh, and sometimes as far as your foot. Mostly likely, that tingling or painful sensation going down your leg is caused upstream in your spine, such as a disc irritating, compressing or pinching a nerve, a facet joint at the back of a vertebra which is out of alignment, a strained back muscle spasming and painfully squeezing a nearby nerve or nerve sheath. Multiply these issues by the number of vertebrae and muscles in the back and you can appreciate how much work it can be to accurately diagnose the root problem. Even with technology like MRIs. Which is why most doctors feel they're doing the best they can with the resources available. That's why I prefer to take a more self-directed, holistic approach to fixing sciatica. So how do we fix the pain and numbness? Recently, a successful yoga instructor came to my clinic and, even after decades of yoga, for some reason, she still suffered with sciatica. I don't know about you, but I was under the impression that yoga instructors and their active, stretch-filled, muscle-focused, posture-perfect lifestyle would be the last people on earth to experience back pain. Actually, I was rather shocked. If a 45-year-old, healthy yoga instructor can be dealt a crippling back pain blow,